Hi, my name is Alex Cayot, student ID 2936068. In this video, I'm going to demonstrate how to calibrate a refractometer. We're going to demonstrate how to draw blood. With that blood, we're also going to show you how to make a blood smear, stain the blood smear, review the blood smear, and then we're also going to show you how to do a PCB tool socket. So here we're going to show you how to clean and calibrate a refractometer. Refractometer used to look at your total solids and your urine specific gravity. We have your prism, your plate cover, your tube, your calibration screw, and your eyepiece. This piece comes off when you need to calibrate it, and you stick your little screwdriver in here when you need to, and you can adjust it that way. So you always want to go off what the manufacturer guidelines are for your cleaning. You always want to use distilled water and chem wipes that are sensitive for the glass, because the glass can scratch very easily, so you don't want anything abrasive on it. So we'll clean it. We use distilled water. Always want to make sure you dry it off really good. Your eyepiece. So when you want to calibrate it, you always want to look at the specific gravity side, and you want it at 1.000. Distilled water is neutral, so that's what it will always come up as. If it's any higher, any lower, you need to calibrate your refractometer. So let's see what we have. So you're going to look up at the light when you want to look through it, and you want to adjust your eyepiece to make it clearer for your view. Sometimes it's going to be at someone else's, so you won't be able to see, so you want to adjust it so it's to you. And ours is at 1.0, but just for purposes, you're going to put your little screwdriver in here. You're going to look up to the light, and you're going to turn the screw to calibrate it to 1.000 on your specific gravity side, and then it's calibrated. So that is how you clean and calibrate. This is Lovely. We're going to get a CBC for her treatment today. So what you're going to do is we're going to do a jug stick today on her. So we're going to evaluate her neck. Looks good. You want to hold off down at the thoracic inlet, so you can occlude the vein so it fills up with blood, so you can feel it. So we can feel the blood there. I forgot my alcohol. So we're going to use some alcohol, wipe the area. And then you're going to have your bevel up, and you want to go at a 30-degree angle when you go to draw blood.
How's Jonesy? Shelby was able to break it up a little bit, and she got a few pieces out.
And that's how you draw blood. So what we're going to demonstrate here is making a blood smear. So we're going to use our EDTA tube, whole blood. So it's a fast motion, so I'll explain it first. So what you're going to do is you're going to put a drop of blood on closest to the frosted side on the slide. You're going to take your cover slide, you're going to pull it back so that the blood reaches across the whole width of the slide, and then in one fluid motion you're going to go forward, and you want to create a feathered edge on the slide from the blood, because that's where you're going to evaluate for any clumping from the blood smear. So we'll make a slide. So we're going to stick our wood sticks in here. Because they're not level. There we go. There we go. Take our slide. Okay. We'll do one more just for funsies. That one's too much. So what we're looking for, and this is a good example of what you're looking at, you want 3/4 of the slide to have your blood smear. This one had too much blood, so that's why it went all the way to the edge. So what we have here is we have your body of the blood smear, your monolayer, and then your feathered edge. So we're gonna let this dry, and then we'll stain it. But that is how you make a blood smear. So what we're going to show you now is how to stain our blood smear after it's dried. We use a 3-step diff quick step here. You have your fixative, your eosin, and your methylene blue. Your fixative, you're going to leave it in for 60 seconds, and the other two you're going to leave in for 30 seconds each. And you're going to rinse in between. So we'll go ahead and we'll stain our slide. The waiting game is so much fun. I love fast forward.
What are you doing?
Okay. I'm gonna fast forward through it anyway.
You have to say you're rinsing.
And that's how you stain a slide. So what it does is the fixative actually fix the cells to the slide. The eosin has the components of the cells sticking to the slide, and then the methanol blue has the acidic forms of the cells stick to the slide. So let this dry, and then we'll evaluate it for our manual CBC. Dried, we're going to evaluate it with our microscope. So what you're going to do is you're going to, on the 100 power, evaluate your feathered edge to make sure you don't see any clumpings, abnormalities, and you can also look for microfilaria at the 100 power. And then you're going to move to your monolayer and go to the 1000 oil immersion. to evaluate your cells for your manual CBC count. So you don't have any errors in miscounting and overlaying. It's good to evaluate your slide, starting at one spot and move down in an even layer, so you don't miscount or overcount things. So we're going to put on our slide. They also have, when you're doing your CBCs, we have a counter for us, so that's going to count as we go. There are also apps that they have now that you can use your phone for it. And then when you do your calculations there for your white blood cells is percentage, and then you do your absolute values when you're done. So we're going to evaluate. Make sure ours are good. So looking at the feathered edge, there's some clumping of some of the cells here. So we will look in our monolayer and see what we have. So you're gonna get your oil. So we're gonna put it on our slide. Oil down. Lots of platelets. So once you've gone over your slide, your monolayer, you'll have your counts, and then you'll be able to do your absolute values. And that is how you look at blood smear for manual CBC. Alright, so what we're going to show you now is going to be a PCV12 solids. We have the heparinized hematocrit tubes for our blood. So we'll get our tubes out. You always want to do more than one, so in case when you spin it down, the clay pops off and you lose your sample. Our clay. So you're going to fill your tube about 3/4 of the way. And you're going to put it in the clay. So then what we're gonna do is we're going to put this in the spinner, and you wanna run it for 2 to 5 minutes. We run it for 2 minutes here. And you always wanna place the clay on the outside at an even balance so it spins evenly. That's how we learn to fast forward things. I'll ask if I can just stop and redo that, you know what I mean? Let that fast forward. So now that our hematocrit spun down, we're waiting for it to stop. There is a brake button on here, but you only want to use it if there's an emergency. Basically, if the hematocrit tubes have broken and you have shards of glass rolling around in there, would be the only reason why you should do that. No.
Hold on, I'm coming over here.
So that is our hematocrit tube. And our other one apparently broke in our spinning, so we'll clean that when we're done. So when you look at your tube, you have your packed red blood cells down here, your clay is right here. There's a small little white line in here. It's called your buffy coat. That's your white blood cells. And this is your plasma. If your plasma looks red tinged, you have hemolysis and you have to redo your sample because you'll have a false read. So what you're going to do is you're going to go to the bottom clay or the top of the clay, excuse me, goes at the bottom red line, and the top of your plasma goes at your top red line, and you read at the bottom of the Buffy coat. So for this one, we are about 26. So that's measured in percent. So our PCV is 26. And then, so your total solids is measured in grams per deciliter. So we're gonna break over our tube. And then you're going to place it over your prism. You don't want to touch the prism because that can actually scratch it. So we're going to get our sample on our tube. There we go. So then you're going to close your prism. You're going to look up to the light and you're going to look at your sample. To make sure that it's focused to you, you want to turn your eyepiece to make the image clear. And this patient has a greater than 12 total solids, so greater than 12 grams per deciliter. And that's how you do a PCV total solids.